A very warm good evening to you. Our very next guest is one of the pioneers of the breast screening program and medical practitioner, Dr. Shirley Jhagroo. Dr. Jhagroo, welcome to this very special one-on-one.
Thank you very much. And it's a pleasure to be here.
You are most welcome. You've had a lot of support over the years for the Walk for the Cure campaign. Would you say that Barbadians may have changed their outlook on breast cancer awareness?
Oh gosh, yes. We've come a long way from 2000 to 2024. Amazing. And it has made a difference. The awareness, which came from the walk and other things, but the walk mainly. I'll give an example. For instance, when we started this program, breast cancer was looked at as a death sentence. You develop breast cancer and that's it. There was no cure, you were going to die. So people used to hide when they thought they had a lesion in the breast. It also had a stigma attached to it. Today, you can see people are talking about it. They're going on the public and the press, everywhere in the media, saying that they're survivors of breast cancer. Now, the awareness, which came mainly from the walk, has definitely made a difference because we have more and more people are coming for screening at the breast screening program of the Cancer Society. We are a subcommittee of Barbados Cancer Society, so we're a charitable organization and an NGO. For instance, we have now approximately 38% of our patients that are attending the clinic that are coming for screening themselves without referrals. We call them self-referred patients. When we started, we would have 1 or 2%. So you can see the awareness has made a difference. And on top of that, which is very important, which was the objective of this whole program, is early detection.
Can you speak to that link between unhealthy lifestyle factors and breast cancer as well?
To a certain extent, there are few risk factors. To date, we still do not know the exact cause of breast cancer, and we haven't got a complete cure. We do know that between 2 and 5% of breast cancer are associated with a family history and a gene. Other than that, we don't know. But we have people that fall into a risk factor. Those persons are people who are at a higher risk of developing breast cancer than the average person. Now, those people can fall into the category of unhealthy lifestyle. One is obesity. 2, alcohol recently has been associated with breast cancer. And cigarette smoking. Nicotine has been associated with so many cancers, including breast cancers. So some of the unhealthy things that people do in life they should maintain a healthy lifestyle, eat the right things, exercise. All these things over the years have been shown to make life a lot more comfortable. People live longer and healthier people. Screening, for example, for not only breasts, but for prostate, cervix, colon. These things detect cancers before they spread, before they become life-threatening. And they all make up a healthy lifestyle, screening yourself for. Men should really, I honestly think, their lives could be saved if they would go and have themselves checked for early prostate changes.
Dr. Jhagroo, what are the numbers like locally for those women who have been coming forward for early screening of breast cancer?
Well, I can only speak about our clinic. Now, at our clinic, we have an average of about 700 patients turning up every month for mammograms. So the workload is heavy. And of course, we have top-of-the-line equipment. We have a tommogram, which is the latest for detecting early breast cancer.
Dr. Jhagroo, how does early screening, having a mammogram done in the early, transform or is likely to transform the life of someone who may be diagnosed with breast cancer?
Okay, with screening, there's a chance of a very early diagnosis. Now, if you have early diagnosis, you have stage 0 to 1. With 0, the cancer is just there in some part of the breast and hasn't moved anywhere else. With those people, their 5-year prognosis is almost 99 to 100%. Okay, so they would have a normal life after. They should. Now, but they have to be careful and do the right things, such as avoid cigarette smoking, avoid too much alcohol. A social drink is fine. I'm not saying to give up that, but there are studies that are showing that more than 5 drinks a week and so can be related. At the moment, as I said before, we still don't know the exact cause, but they're looking. A lot of research has been done, particularly in the United States, on breast cancer, particularly about the cause, the etiology of it. And they're still looking for cures. There's so much research. So the lifestyle after can be a very normal one, but these patients tend to, I do talk to a lot of them, okay? And we also have a support groups. We have 2 support groups in Ireland. Well, no, I think that there's a third one at Queen Elizabeth Hospital. And they are very careful with their diet. And I know a lot of these women exercise and they look at, everything to make sure that they're doing the right thing. In the support groups, in actual fact, they have lectures, ever so often on their diet and on exercise and physiotherapy and all sorts of things to give them all not only hope but positive thinking and to make sure that they're doing what is supposed to be the right thing in their lifestyles.
Mm-hmm. What should that positive thinking and positivity look like?
Well, if you think positively, positive things will happen.
That's a fact.
Yeah, negative thinking, what happens then? You get into depression and, you see something small, you always tend to emphasize it. But, positive thinking and believing, well, you don't have to be a Christian, you can be a Muslim, you can be a Hindu, but believe that there's a God and that God is going to take care of whatever you cannot take care of. You have to, and I find this with a lot of survivors, they give it to him and say, I have no control over this. You have the control. I'm giving it to you. Take it. And then they leave it there, or they try to leave it there and hope that that's what will happen. And they do well. I listen to a lot of them. How do you look at life now after you've had breast cancer? But sometimes, most of the days I feel so norm. And sometimes, well, I think that it can recur. Yes, that is a possibility. But don't think of that. Don't think of the recurrence. Think of what you've been through and where you are now and where you want to be.
Are you concerned about the lack of data regarding breast cancer in Barbados or the Caribbean?
Well, yes. Well, of course, we don't do research, or not much research. And I feel we should do, but then it costs quite a bit to do the research. So we depend on what research is done elsewhere, and we go with that. In actual fact, at the breast screening program, our protocols for early detection of breast cancer comes from the American Cancer Society, and we tend to stick with it most of the time. They have 3 protocols, or 3 things in the protocol, and we follow that. And I must say, we've done well. We've done very well. The 3 protocols are breast self-examination, which is what we're trying to do this year. Because over the years, we've been preaching it and part of the education program and breastfeeding. But now this year, we have feel it, find it, fight it. And I think that's a wonderful logo. Because if you don't search, you're not going to find. Do you agree with me?
Yes.
Right. So for them to search for these things on the breast, know the normal breast. And then if anything turns up, you would know. And if something turns up, we're asking you to go and have it checked. Nobody, no doctor, no surgeon can just feel and say, it's okay. So we're begging the community, we're begging the public out here, do not accept that a doctor or physician, no matter who it is, say to you, oh, that's okay. You're too young or you're too old. It's a no-no. So the second protocol is have an annual check by a physician, your health personnel, once a year. And they will check your breast for you. And then the third thing is screening, mammogram screening. And very often we have to revert to mammogram plus ultrasound because mammogram is, of course, is still the gold standard. And we're looking for certain things in the mammogram that will tell us, yes, this is breast cancer. At the breast screening program, we have a one-stop clinic that we do biopsies, and we have excellent surgeons that work there. They're volunteers, but they're amazing. We're now looking to grow because we've outgrown what we have. So I'm hoping somebody will be kind enough to give us a building so that we can grow some more because there's a lot more that we can do.
Are you making an appeal to corporate Barbados for
Not
continued?
yet, but I intend to over the next, very shortly.
Yes.
Very shortly, I intend to because we have containers putting stuff in. We have patients sitting in the corridor waiting for the mammogram or ultrasound or whatever because we're running out of space.
In making mention of corporate Barbados, since the partnership with CIBC, you've seen further support and buttress by
Oh gosh,
Barbadians
yes. Oh yes.
for Walk for the Cure. How do you feel about the fact that CIBC and these corporate sponsors found it so important to support such a cause?
Well, you see, breast cancer has touched almost every person on this island. You have staff, women there have been performing well, the next thing they've got breast cancer, and that kind of thing. So I think that's one of the big reasons. And women themselves, women talk about things, unlike men. And they would talk at work and they would, we have an amazing number of people that would come without being Breast Cancer Month. Do you have t-shirts? Can I get t-shirts, And they would still wear pink off and on during the year. They would wear the pink ribbon. They would do things to support it because they've had friends, relatives, and that kind. So they've been touched by breast cancer. When you see those patients who were diagnosed years ago, and they don't forget you, Dr. Jhagroo, you found that thing. And I went to the Cancer Society and showed up on the mammogram. How many years? 8 years ago, 10 years ago. It really, really motivates you to do more, want you to do more, And I have a lovely team of subcommittee members, women, retirees, ex-bank managers. I just have 2 doctors and education people. They are all fantastic. I mean, these ladies were out selling t-shirts in the container at Sheraton.
Everybody's pitching in.
Yes.
Wonderful.
They're wonderful volunteers and they work, oh gosh, I would see them in the container from 9 in the morning until 3 o'clock. They don't even go for lunch. They were amazing.
Would you consider this support for the campaign and this support for breast cancer awareness, do you think this is a type of behavioral change that you've been seeing since you've been putting that education out there?
I think so, where cancer is concerned. I remember years ago, in 1980, I was involved, I was pioneering that program too, the pap smear screening program on the island and the family in the polyclinics, right? And it was quite difficult really quite difficult to educate the people about coming for pap smears and screening for pap smears. But why are you doing that? And you go through the whole works. But today, it's a completely different scenario. It's made a lot of difference. The walk, the awareness, people sometimes are educating themselves. They come and ask questions, and that makes a difference.
Are you concerned in any way about young women coming from marginalized communities within Barbados and having a lack of access to education or a lack of access to resources?
Well, yes and no. We try to go out into the community, We have a mobile vehicle that goes into the community. They go all the way up to St. Andrew, St. Joseph, they go everywhere. And with nurses in the vehicle that will examine their breasts and teach them breast self-examination. So we're trying to go into the community to teach. What we need to do now, however, I think, is to go into the schools, the secondary schools, and teach the adolescents, the young girls, and boys, of course, on breast self-examination, which is probably something we'll do in the near future.
What are some of the advances in technology that you're most proud of? I know you were mentioning some of the equipment that you have at the Barbados Breast Screening Center. So can you speak to that as well?
Well, we started in 2000 with what's called an analog, which is the basic mammo machine. And every 10 years from then to now, we have upgraded. I tend to do this with whatever is happening overseas. 10 years later, we moved from the analog to the direct digital and mammograms, which was the thing in 2010. And then 2021, we moved to the 3D or tomogram, which is what is being used in all the first world countries now. And then added to that, we've got the stereotatic biopsy attachment that goes with the 3D, which is very, very specific and accurate for doing breast biopsies, particularly biopsies which is seen on the mammogram but not felt with the hand. And you can't miss if you use that. This is why our biopsy rate and success with biopsies are so good. Our surgeons don't miss because they can't. It tells you exactly where the spot is. And we've invested. And you know where all this money comes from? The walk and donations. I have bought the different equipment over the years from funds raised from the walk, donations, corporate Barbados. We've never borrowed any money. Now, what happened with this last one? It was costing 1.3 million Barbados, and we bought everything from the same company, General Electric. And what they did was take back the first machine we had, but I pay for maintenance. We pay 125,000 Barbados a year in maintenance for these machines. That's why we always have kept them well. And they took back the first machine and deducted 300,000 from the newest one. So we got it for $1 million. And we've always, over the years, had the best technology in imaging that there was for early detection of breast cancer.
How do you feel about the success of the walk this year and funds raised as well?
Well, I'm not sure how much funds were made, but we sold a lot of T-shirts. We sold a lot of T-shirts. And I was expecting this to be the biggest walk ever, but the rain came.
Yes.
The rain came and spoiled it. Who was there walk though? People loved it. They thought it was cool compared to expecting it to be so hot. We had extra water and all that, but people said it was lovely. But those who hadn't left home yet to come, I suppose they changed their mind. But T-shirts were sold. We sold a lot of T-shirts. I personally think we would have got by 25,000, but I don't think we got 20 like we did last year. But T-shirts were sold. And that money now this year, we have to pool that with last year's funds, and we've invested it in a new PACS system. The old PACS we've had for the last 23 years, and it was full. But these imaging that we do with the new machines, we're running out of space. So this new PACS that we've bought has a backup from iCloud, and it's unlimited. So it's costing us 250,000 US. So we raised funds last year, and we've raised this year again. So I'm hoping that would be enough to pay for the PACS system. But something is already installed. Since we paid the deposit last year, the people, of course, they trust us. We're a group of integrity, women of integrity, and people trust us. They gave us the machine, set it up, and it's running and doing really well. And we've only paid 76,000 on it. Normally, you pay before it's installed. But they were quite happy to us. Are we hoping this year that we would have enough to pay off for the machine? because we have vision of other things that we need. Our vehicle goes into the community. The roof is rusting and had holes. We have just tried and patched it up. And it's 18 years old, but we've taken such good care of it.
How do you feel about these government support? You've had plenty of support from the private sector, but are you satisfied with the support from the governments as well?
Well, I'll be honest with you, we haven't really asked, but they've been very generous in allowing the equipment all to come in duty free. But I just want a nice building now that we can do so much more. You know, we can actually, we do no treatment. Huh? This program is all about early detection. And we've done very well. I'm very proud of the response and the staff. Whatever's being done in that clinic is beyond words. It really is. Our little success story is that last year, March, 23 March, we did a review on patients who was seen 5 years before, was diagnosed 5 years before with stage 0 and 1 breast cancer. We were able to find those patients and they were all alive. So can you imagine how the nurses in that felt?
Yeah.
When they call and there were 3 of them in the States, but you know, they managed to track them down. Oh God, yes, I can't even remember. I don't even think about it. I'm doing so well. You know, that kind of response. So it just makes you want to keep going.
Dr. Jhagroo, why was it so important for you to dedicate your life to breast cancer awareness and prevention as a medical practitioner?
Okay, well, I'm a gynecologist, really.
Yes.
And I was trained in the UK. And in gynecology and obstetrics in the UK, the breast is an important part of the female body. And so we were taught from way back when, as final year medical students, that if you do not do a breast examination, or you cannot say her breast was fine in your findings from after an examination of a female patient, you really would be told off. So I got into the habit since then of examining female breasts. Okay, then when I left Queen Elizabeth Hospital and I was in private practice, I would see a lot of stage 4 breast cancer. And that really, really did affect me. Similarly, when I was in colposcopy at Queen Elizabeth, I saw cervical cancer, and that prompted me to get involved in colposcopy. So the same thing happened here with breast. I would see this stage 4, and there's not very much you can do for them. And I know in my heart that if these people were diagnosed early, this would not have happened. Then I went to the Minister of Health, which was Liz Thompson at that time, put my plans to her. She looked at me and said, "You buying?" She was very young and very, "You buying a machine for $1 million and putting it in a container?" And I said, "Well, I don't have a building. I mean, what else can I do? And if you're going to rent and put in all these things, it's going to be very difficult." And she said, "No, I don't agree with that." She looked at my plans. "I don't agree with that." I said, "But you know what? I have a suggestion. If you can go out there and find a building that belongs to government, come back to me." You know something? Within a day, I found a building. I had asked people all over. I'm like that. We found the building, went back to her. She says, "Consider it yours." I'm not sure who it belongs to. I know it's a government one because you've told me such, 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 but I don't know what ministry it belongs to. But I'll find out and I'll get in touch with you. We got the building. We had to be refurbished though. It was in a bad state. And Cancer Society then came on board and we shared it. They took a mortgage and refurbished the building. So we got quarter of the building though, unfortunately, thinking that, you know, this breast thing is not going to take up much space, but it did. We've grown now. We've outgrown it. And the end of the building is early detection for prostate. They still do the pap smear screening program and all that. So this is where we are and where we've come from. So this is how my passion, my passion for breast cancer has taken me. And I have quite a few in my subcommittee who feel very strongly about it. Unfortunately though, we're all getting older. And I honestly am putting out, as you're talking to me, I'm putting out an appeal there to younger people to come in. It's not easy to find people that would feel as passionate as we do and did, but they could if they see the difference of what happened in the past and what's happening now, and the importance of this program. And there is life after breast cancer with early detection. And this is what this entire program is all about. Breast self-examination is one of the most important things because more than 80% of people that find lesions themselves and then go for checking.
It's a long road we've traveled, Dr. Jhagroo, but inspiring nonetheless. At this time, we're going to pause for a short commercial break, but we'll be right back with more one-on-one with Dr. Shirley Jhagroo.
Welcome to beautiful Spikestown. I am Wellington Blackman, entrepreneur right here in Spikestown. A clean Barbados is indeed a healthy Barbados. So let's join our hearts, let's join our hands. A clean Barbados starts with me, a clean Barbados starts with you.
Welcome back to this very special one-on-one. We're sitting with consultant gynecologist Dr. Shirley Jhagroo. Dr. Jhagroo, how would you say breast cancer diagnosis affects a person's overall quality of life, physically, mentally? Can you speak to that as well?
Well, you know, any cancer would affect. We're human, okay? And it must affect us because you think of cancer and death. They go like that, hand in glove. And it depends on the patient's or the person's personality and their attitude to life. Two persons can have exactly the same situation and circumstances, and I will come out smiling, and you will come out, oh God, I'm depressed, I can't do anything about this, you see? So it's the same with cancer, to be honest. I found that with women because I've seen people who are bubbly and, well, I've beaten such and such before. I can beat this too. And, if they have that attitude, they will beat it, and they come out on top. You have the other patients and other persons that will go into this with a very negative attitude, approach, and what happens to that person? She just sees death. They think it's going to come back. And her life, her day-to-day living, it's not the same, because she's always thinking of this recurrence. And she's thinking, I can't be the same, and I won't be the same. No, that's not the way it should be. Look at it this way. I can beat this. Others have done it. And I can do it too. So I say this to them when I find them like that. And say, but I'm not the same as such and such. And I said, but you could be. See how she is. You see what she's doing? Look how she's doing this and that. She's going to the gym. She's doing dance classes. You can be part of all that. And these things help them to hope and look at life differently. And this is what we have to do. Family support is very important too, If families will listen, this is not going to get you. We're going to do this together, Husbands, partners, children, friends, they all make a difference. Because being a loner in situations like this, who are you going to cry with? Who are you going to, tell your story to? Who are you going to say even your happy good mornings to? So it is important that we look at it again with that very positive attitude. I can beat this, and I will beat it. because I'm going to fight it.
Do you see the need for more advocacy groups and mental health professionals within the envelope of breast cancer awareness?
Yes, definitely. Um, One of the sad things about mental health in Barbados is I feel we're not doing enough. We can do a lot more. Because illness is much the same as any other illness. And people should not be allowed to get into very difficult situations because they can't help it half the time. But enough advocacy in health in illnesses like that can make a difference. Remember, breast cancer had a stigma. Cervical cancer had a terrible stigma, in the 70s. You were told if she had cervical cancer, if she sinned, she went with the different people. She got the cancer from Mr. So-and-so. It was awful. All the myths that were associated with cervical cancer, we fought tooth and nail, education-wise, to encourage people to come for the pap smears. They weren't coming. They wouldn't come. But it all ended well because we went out there and educated the public that this is necessary and that there was life after cervical cancer if it was diagnosed early.
Dr. Jhagroo, after a mastectomy, obviously there may be some concerns or earth-shattering concerns by some patients regarding how they will be perceived in the general public, regarding implants and so forth. What advice would you have for women after a recent diagnosis where breast cancer is concerned?
Well, yes, everyone can contribute towards this. Medical practitioners, friends, anyone who knows the person well, or you don't even have to know the person well. But if someone has to have a mastectomy or lumpectomy, or you can reassure them. And now with reconstruction, you don't have to be without a breast because reconstruction breasts are beautiful. And not only that, you can get replacements, things that look really good. Patients should always be encouraged. There's nothing wrong. You're not losing your femininity when you lose your breast. It is for you to realize that it is more important to have this breast removed to save your life than the cosmetic effect of it. And people do, I find that today women, oh gosh, yes. That today, and you know something, we are finding younger women with breast cancer today. And they are quite happy to have their breast removed and to have reconstruction. They would wear prosthesis, but not for very long. The older women are quite happy with the prosthesis, but you can get very pretty ones. It replaces the breast. You look well with your clothes on. But the younger women are quite happy to have reconstruction. So, and in the States, you can have it done free. In the UK, you can have reconstruction done at the time when the breast is removed, costing you nothing.
You've made mention of the fact that younger women are also being diagnosed with breast cancer. Why is this particular trend existing compared to years gone by?
Breast cancer used to be looked at as a postmenopausal woman disease, remember? It was older women over the age of 50 that got breast cancer. Today, we're seeing women in their 30s and 40s with breast cancer, even younger. We had a girl of 22 with breast cancer. So research to date has not come up with anything that is more positive in the approach. The approach is much the same as a middle-aged person, not the older women, but the middle-aged. And what we're doing now is offering, depending on the type of breast cancer, the surgeons and oncologists would offer the type of surgery and treatment that is necessary. And I find that today woman accepts it, with the hair loss and all the side effects of therapy. They do accept that this is going to happen, but it's okay. my hair will grow back, or I'll shave it all before therapy starts so I wouldn't see it falling out. People do that sort of thing, so they accept it. It's accepted. And research, in actual fact, what I've seen is they have a thing called cold head treatment. What they do, to put on this cold bonnet on the head while they're having the treatment. And for some reason, that tends to prevent the hair from falling out. So there's some advances from the cosmetic side in managing people who have to have the different type of treatment. Surgeons now, what they tend to do, which I've seen recently, is the oncologists that is, they tend to give them chemotherapy to shrink the breast cancer before they do surgery. We're doing this now in Barbados. There's some oncologists and surgeons, and that's another thing. There's teamwork between them. I would suggest that let's do the chemotherapy first, and then do the surgery. And the surgery then is less aggressive. The lesion is smaller, and it's more acceptable by the patient to have less aggressive surgery kind of thing. And then they probably have radiotherapy after. But that's one of the developments over the last few years.
What are some of the particular trends in research and technological advances that you find particularly promising throughout the world?
In breast cancer?
In breast cancer, yes.
Well, once it's diagnosed early, there's a lot more treatment options. There's a lot of research, much more research being done on breast cancer, particularly in the United States. And we're hoping that with all this research and trials that are being done on the different types of breast cancer, that there will be a cure. There is this hope all the time that we're going to find a cure. And there's also this hope that we would get the exact cause of breast cancer. Because we still have to explain 92 to 95% of women who get breast cancer that have no family history. Family history only explains 2 to 5% of them. We have to find a reason for the others. We haven't found any of those. So this is what we have to do now. Wait and hope. But we can't do it in these parts because we don't have the finance. But it's happening in the bigger countries.
Is there any hope that with partnerships by international corporate partners that we may have enough funding for in-depth research?
Yes.
Within Barbados as a small island developing
but
state?
Barbados, I feel not, But the Coben Foundation and people like that, and they do a lot of work. A lot of money is involved in cancer research, not only in breast, but other cancers. Remember now, cancer is the #1 cause of death globally. So we have to do something about it. And the important thing at this point in time in saving lives is early detection. I can't emphasize that enough.
There's no exact reason for the origin of breast cancer, but are there any preventative strategies or any advice you would have for women watching One-on-One right now where breast cancer prevention is concerned?
Well, there we go again, because we still don't know the exact cause.
You don't know the exact
How
cause.
are we going to prevent? Okay. But these people that are more at risk is because research has shown that, that type of person has a higher risk or tendency to get breast cancer. So when you come to people like that, you have to be more conscious of the fact that you're at risk and do what is supposed to be the right things, like do your exercises, eat the right diet, stay away from certain things that can predispose you to cancer, breast cancer. As I mentioned those before, alcohol, cigarette smoke, and these kind of things. Obesity, exercise is so important too, that people stay on that kind of lifestyle.
How can we ensure that women with breast cancer have access to affordable and effective treatment as well?
Well, in Barbados, the treatment is free. You can go to Queen Elizabeth Hospital, and once the drug is there, you can get it, and you get it free. So we're quite fortunate with that. But there are times when the drug is not available, that the drug that the oncologists require is not available. And what happens sometimes is that they might have to buy it and bring it in and that type of thing. But more often than not, it's available at the hospital and the patient can get it. So they do get most of the drugs free.
Are you concerned in any way regarding insurance coverage?
Well, yes, of course. For instance, now, if the drug is not available, and that's the best drug for the patient, she might be asked to bring it in herself or to get it herself. She might not be able to afford it. And of course, then she has insurance. Insurance will pay for it. Insurance is very important, particularly when you have to have major surgery. If it's emergency and you get to the hospital, it's fine. But sometimes when you are waiting on a waiting list, it can go on for quite some time. And then it would be sometimes a year before you get it done. Sometimes you don't even get it done. But if you have insurance, insurance pays 80% of that. And I would advise people who can pay insurance. And BARP has very good offers, and they've gone right down to the age of 40 now. And that helps a lot. The premium is not that high. And it's encouraging, and it's a guarantee that, if you need surgery, you get it done.
Over the past couple decades that you've been involved in breast cancer awareness advocacy, what were some of the most challenging factors in terms of spreading this awareness and trying to, have reformulation in terms of behavioral change?
Well, there have been a lot of challenges, and people have this fear, they're myths. Education, as I said before, is very important. Among the myths was things like doing a mammogram can cause breast cancer. Having a biopsy can make the cancer grow more. These are the challenges that we had, and we had to try our best to educate people. Some people still feel that way about it, though, so you have to keep working at it. It's very important that you do, so that they are encouraged. Because you see, in an island like ours, Mary tells Jane, Jane tells Teresa, and this goes on, so you have to be careful that Mary gets the right information and she can pass it on to the others.
And even though you've had these challenges in terms of misconceptions and existing myths, what are some of the success stories you've had? Walk for the Cure. You've seen improvements in terms of the type of access to certain technologies. But what were some of the other success stories over the years that you've been involved?
Well, when you see a patient who's had surgery or had breast cancer 18 years ago, we have those. One of the young ladies who works at the Ministry of Health is one of my favorites. And she goes around saying, well, I was one of the early diagnosed ones in 2000 and I'm still here. And she, things like that really is a big success story. And then you would hear patients who've had, well, in those days, years ago, they did mastectomy a lot, who would have had a mastectomy, and she's now 35, 40 years and alive and well and not had a recurrence. I would say mainly those are the success stories. And the patients encourage one another, I know of one at the present time, and she must have spoken, if she has not spoken to 50 persons about her breast cancer. I'm sure it's more than 100. She was one of the people that was at the walk, and she was detected with absolutely no symptoms, nothing to be found on the breast. She went for a routine mammogram, and this tiny little thing, less than 1 centimeter, was seen. She had the biopsy, and it turned out to be cancer. She just had a lumpectomy done, and she had chemotherapy. She didn't have radiation. And I mean, she tells everybody. So she keeps saying to people, okay, check your breast, go for your mammogram, you have to go. And people, you know, you listen to the people there in your community and in the villages, quite often, more than you would listen to the health personnel, you know. Because
That's true.
health people tell you certain things, and your neighbor will tell you something else. And you tell, you know, she's experienced it. What does my health person know about this? This lady had breast cancer, you know? So this is why we use them as advocates. And it makes a difference. Years ago, we couldn't get anybody to go on the television or radio or
to share their lived
to share their living experience. They would not. I used to beg them, I'm coming with you. We're going to talk about this. Oh, no, not doing that.
But that has changed now.
Oh, gosh, yes. They're willing to go. I mean, people say to me, you can use me, you know, I'm ready to talk.
Would you say the partnership with traditional media and non-traditional media? I've heard a lot about your campaigns via radio, via television. Yep. It was on the lips of most Barbadians. Yes. So it seems as if the support from the media partners as well has really helped to
made a difference.
Drive home that change in behavior as well.
The media has been with us from day one. We got such support from them, and it has made a difference. You know, when you put everything together, they all made a difference. Even persons telling one another makes a difference.
Well, we are not going to touch on policies so much, Dr. Jhagroo. What role can our government play in promoting breast cancer awareness and outcomes as well?
Okay, education is number one. That's why I was saying to you earlier that if we can go to the schools and start the awareness and education in the young ones, you know, adolescents, teenagers, on breast self-examination and why it's important. That's one of the big things, and government can help us with that. Ministry of Education can help us to get people, allow our nurses. We can provide the nurses, allow our nurses to go into the schools, secondary schools, and teach this. That would make a difference. And then, of course, you know, at this point in time, the breast screening program, I said it before, has outgrown its building.
Its current location.
Yeah, its current location. And it can do more. We can offer treatment, in actual fact. It's an early detection clinic, but we can offer treatment to patients in a more comfortable environment. It's a non-governmental organization, but we could offer better treatment. Well, not better treatment, we can offer a better homely environment for them to come for their chemotherapy. Radiotherapy is going to be good later on because we're getting a linear accelerator, which is the thing that should have been here some time ago, but that's coming soon. And with that, it can make a difference, definitely make a difference to prolongation of life.
Having those school tours and starting with the very young in terms of preventative care awareness.
Yeah, awareness.
What are some of the funding goals that you have currently within your remit?
Yes, well, we need to have a new mobile vehicle so that we can continue the teaching, breast self-examination, and actually examining breasts in Barbados. We haven't reached all the communities yet, but you know, corporate Barbados very often request that the vehicle come to their location. So we go to insurance companies, we go to supermarkets, we go to banks, various areas in the island. The mobile vehicle is there. We send a nurse and a driver, and they send their staff. So we're actually taking it to them. They don't have to come to the clinic. This is just for them to be taught how to examine the breast. And they have a breast examination at very minimal cost. So we really need a new vehicle because it's 18 years old and it can go at any time. At the moment it's leaking. So that's the other vision we have is that. Now the PAC system which we wanted, we should have all that paid for by the end of this year. And then, of course, Shirley Jhagroo is going to find things that I'm famous for that.
Yes, very much
Everything
so.
that we need, any new technology, better technology, and anything. But at the moment, but what we need too, which is very important, are to have other doctors, other medical personnel that would give of their time, their talent, and feel strongly enough that they want to be part of this, part of early detection of breast cancer, and what they can contribute. It's nothing you're going to get any reimbursement for financially, but you get reimbursement from giving
Yes.
and seeing the giving of your time and whatever you can, and then seeing that these patients are alive and well. I mean, the most important thing for people is life and quality life, isn't it?
Very much so.
Right.
Very much so.
Good health is education. These things are very important. And if you don't have a healthy nation, you can have all the wealth in the world. It really cannot compensate a healthy nation. And women are important because we live in a matriarchal society. You realize that? What happens to the women today? They are the breadwinners in so many situations, in so many homes. And we have to acknowledge that. So we need to take care of these women and their health and their breasts and their cervix and their uterus and all these things that's going to give them quality life. I'm not saying that men shouldn't, but seeing that we live in a matriarchal society,
We must take care of our women
we must take care of women.
primarily. Yeah.
And the women must take care of themselves. As women, you tend to be so unselfish. Everybody comes, I'm not one of these people. Everybody comes before me. The husband, the children, the mom and the dad and uncles and aunts and cousins. And then you come along the line somewhere. But it is so. And we have to accept it. I don't think we can change that. But in doing that, we have to remember that we're also important. And we have to take care of ourselves. And we should do the right things when it comes to our health. Or try to do the right things when it comes to